Lung cancer, the leading cancer killer in America, and we know screening saves lives, but only a small number of eligible patients are screened. Here with more is Dr. Dan Boffa. Good morning.
Good morning, Angie.
Well, what are we talking about when we're throwing out numbers and statistics, and kind of walk us through and help us understand who's at risk and what the problem is and who needs to be screened?
Sure. So lung cancer is a disease that primarily affects smokers. So 87% of lung cancer happens in somebody who's smoked. There are people who've never smoked and still get lung cancer. About 1 out of 7 lung cancers happens in somebody who's never smoked. And there may be genetic explanations for that or environmental explanations like radon. But the vast majority of people who get lung cancer are people who've smoked. And so screening right now focuses on the smoking population. So if you're 50 or older and are a current or former smoker, you really should talk to your doctor or your primary about screening.
And what are we talking about? What's the process like?
So it's a CT scan. So it takes maybe 3 minutes to get. You lie on a table, you go through an open donut. So people that are claustrophobic, it doesn't usually bother them. And then you're done. And it's something that if you're eligible, you should really have done every year. Now, screening reduces your chance of dying of lung cancer by 20%. That is by far our most it's our strongest weapon against lung cancer. But as you mentioned, most people are not having it done. So only about 10% of people who are eligible for screening actually get the scan. That's very different than breast or colon cancer, where more than 70% of eligible people are screened. If we could just get half of eligible people to get screened, we would save 20,000 lives every year in the United States. So there's a lot of room to improve just by getting people to get the scans done.
So is the pressure then, the responsibility on the patient, or is that something that should come up when we are asked all those questions in assessments in the doctor's office? Do you smoke? Do you exercise? How does that work?
So in medicine, no news is not always good news. So if your primary's not mentioning it, I do think it's worth bringing up to him or her. And part of it is the screening criteria have changed. They've opened them up to try to get more people to be eligible because we know that it works. So I think that if you're 50 or older and are a current or former smoker, have that conversation. I think a lot of people are reluctant to be scanned because number one, they think it's expensive. Well, honestly, it's covered by almost all insurances, including Medicare and Medicaid. And if you're not insured, a lot of places can help you get it covered. Some people don't want to quit smoking. You actually don't have to quit smoking to get the scan. But at the end of the day, I think a lot of people are just scared. You know, nobody wants to look for something they don't want to find.
Right.
And, you know, I'm scared when I get my colonoscopy. You know, I don't want to become a cancer patient. I don't want to disrupt my life to be treated. The reality, though, is cancer is a common experience for all of us. And I think why not find your cancer when it's early so that the treatment's just easier on you and you're more likely to be cured?
Good advice. Send our viewers, please, to a website where they can learn more.
Sure. At www.facs.org/lung. That's the Commission on Cancer and the American College of Surgeons website.
Doctor, thank you so much for being with us. Important information, life-saving information.
Thank you, Angie.
And more lifestyles for you right after this. Stay with us.